Hello, everyone, and thank you for joining our session on the Georgia Community Engaged Alliance Against COVID-19 Disparities, Community-Driven Pillars, Processes, and Predictors of Vaccination Uptake among Black, African American, and Latino or Hispanic residents. I am thrilled to be co-presenting with my partners in good, Dr. Bella Borhi, as well as Dr. Sadia Kizer, who represent community as well as clinical leadership that have come together as we consider the path forward in response to the COVID-19 pandemic in the state of Georgia. I am a professor and chair of community health and preventive medicine at Morehouse School of Medicine, and also the servant PI for Georgia CEAL, which you'll hear about shortly. And both Bella and Dr. Kizer will introduce the spaces where they live and lead as they talk about their leadership in this important work for our state. So I want to start with the end in mind, and that is we must always begin with our values, and that is that community partnerships are not built overnight, and that partnerships should not depend on a single initiative or a single pandemic, or even a succession of either of those things. Partnerships continue even when there are no grants or initiatives. They represent an understanding of what each partner values. And when those things come together, relationships are the foundation and prepare us to be proactive as we think about the path forward following a pandemic like COVID-19. It also means that fiscal and non-fiscal resources must be shared. And so you'll hear in our discussion today how community leadership as well as resources were central to moving this Georgia CEAL work forward. And hopefully we will be a model to you as you think about bringing together groups that were already doing important heart and hard work to serve and make communities healthier. Our focus ideally really should be on health equity and equitable partnerships. So not just making sure that disproportionately impacted communities are always at the table, but we should be focusing on the partnerships that make sure that we are equally positioned to work together to unseat power differentials so that we can work together to make communities better than they were before. And so for those who might not know, the Georgia and Community Engaged Alliance to address COVID-19 disparities across the nation, it really was birthed out of conversations that happened in the middle of 2020. We all know what was going on. Our heads were spinning amidst the new COVID-19 pandemic, and partners in good at NIH, like Dr. Gary Gibbons, who leads the National Heart, Lung, and Blood Institute, as well as Dr. Alessio Estable, they worked together to make sure that former NIH Director Francis Collins understood that community engaged leadership was an essential strategy in standing up quick response among communities and states that were hardest hit to respond to COVID-19. And so Georgia, unfortunately, we are number one for many of the wrong reasons in terms of HIV, cardiovascular disease, diabetes. And so we were among the short list of 11 states that was invited to bring together leaders to propose and stand up the COVID-19 Community Engaged Alliance Against COVID-19 Disparities. So that is how the National Alliance was birthed, and certainly how our work in Georgia began. And so Georgia CEAL, or the Community Engaged Alliance Against COVID-19, began in September of 2020 and was focused on priority populations, including African American and Latinx communities who were disproportionately dying, being hospitalized, and getting sick from COVID-19. But we remain clear that there were other populations that were disproportionately impacted and could be defined by their geography in the state, by socioeconomic status, social vulnerability, and many other layers of identity that represent us. So no group is a monolith. All groups represent multiple identities that must be understood, and groups like the Hispanic Coalition of Georgia, which Bella leads and will detail, represents an organization that was already doing important work and was well positioned to join us in our efforts to work together. Georgia CEAL ultimately is governed by a state representative, community majority, community coalition board that's designed to make sure that our research and our outreach and our communication strategies were translated with, co-created by, and relevant to communities towards effective education, outreach, communication, and research to get people safe and better than they were before. So very quickly, here have been our priorities over time. We want community-driven trustworthiness and communication. We use the term trustworthiness because it is the journey towards an anticipated end, and that is trust. And that requires relationships and partnerships when there's no pandemic. It requires identifying who's who that is vision and mission aligned so that we can work together and be prepared. COVID-19 vaccine trial and vaccine confidence certainly in 2020 was important. And as Dr. Kizzer will talk about, it's still important to be sure that all groups are represented and can help us to understand what works for whom best when we think about health equity. We are also very clear that vaccine uptake is important, as well as vaccination, but making sure that we are culturally humble in respecting every reason why people feel the way they do and behave the way that they do in thinking about vaccinations and testing were important to us. And so the Community Coalition Board of Georgia CEAL was really designed to ensure that we were accountable. It was designed to ensure that through models at Morehouse School of Medicine, we stood up a statewide alliance that flipped the script from doctor or clinician knowing best to community leaders being positioned based on their existing journeys of trust and trustworthiness to help us to make sure that COVID-19 resilience was our ultimate outcome and that we were prepared for what's next. And so I'm very, very pleased to turn the mic over to Ms. Bella Borghi, who leads the Hispanic Health Coalition of Georgia, to talk about her work in it, but also all of the great work that they've done before, amidst, and in the wake of the COVID-19 pandemic. Bella?
Good day, everyone. Thank you, Dr. Akintobi. I am so proud and honored to be part of the CCB. The Hispanic Health Coalition of Georgia is a 32-year-old establishment who serves all of the populations in the Hispanic, Latino, and Black Latino areas throughout specifically rural and urban, and to bring it to social determinants of health. It takes a village to complete all of what we have accomplished in the last 3 years as a CCB, and to all of the partners who have been major contributors from all walks of life in stakeholderships through our Georgia CEAL team. It takes a village, and the village works every day significantly to paradigmally make better health outcomes in all efforts of advocacy, policy, clinical work, quantitative, qualitative data research, and how we truly are leads cumulatively and better outcomes and improvement of social determinants of health. I also serve as the executive director and vice chairman of the Hispanic Health Coalition of Georgia, where we, as I have stated, have been in the field for 32 years. We also work very significantly in advocacy, policy, and those that impact all of our underserved populations throughout the state. Next. So what is community resiliency? Community resiliency is a multi-pronged approach. It involves the constituents of all of our communities and all of the stakeholders. purposefulness, confidence, social support, adaptability. It not only means that our community needs to be adapted, but we also need to be adapted to ourselves as stakeholders and how we lead and how we see what is coming in the forefront. So when the next pandemic arrives or some type of situation and other chronic diseases and related situations, which hugely impacted the pandemic, can be dealt with in a timely and best in practices manner. Next. So what does that mean? It's connectedness, change of acceptance, clarity and focus, a mission. What is the mission of the stakeholders and what are we trying to accomplish in totality? Sometimes that means to be creative. You need to go where our constituents are collectively and know all of the indicators of what their concerns are, where they need assistance, where better communication needs to be lent, which in totality comes to control management or best in practices for foresight and the completion and addition to milestones and better best in practices in visibility to future scenarios. Next. Challenges and anticipated constraints. All populations have challenges and anticipated constraints. And that also inflects very much in the rural populations. It also inflects very much in the metroplexes because of the social determinants of health of underserved populations. We have issues with language barriers, cultural barriers, transportations, technology deficits, as we saw through the pandemic. Even from a learning perspective, students did not have the tools and capacity that they needed. We did not have capacity for information and for information to get to the public. So from that perspective, that's where the CCB uniquely chartered together and marched forward to make certain that we were all embedded in the field so that we could overcome some of those barriers in real time. Next. Resilience, implementation, and community sustainability. Building resilient communities through education and information and integration is hugely important. But as a CCB member or any of the other members of Georgia CEAL, you need to have trust and confidence within the areas that you're working with. The population needs to know you. Your community needs to know you. We trust what we know. We trust what we need to learn, and we also trust those that we relate to. So being in the field on a daily perspective absolutely augmented all of the work of the importance of all members of Georgia CEAL so that we could take a multi-pronged approach, and to Dr. Akintobi's very well chosen word, we are not monolithic as a society. So we need to see the indicators and milestones and where we need to react and be agents of change when we see new situations on the rise. Create ways to educate. Education in most scenarios is important because we as humans do not know what we do not know. What we were very successful with and continue to be in a collective manner is to engage the entire family, to engage all of the generations within the family, through knowledge, education, overcoming adversity, connecting with the correct resources. And oftentimes in multi-generational families, another generation can be hugely impactful to knowledge sharing and knowledge understanding, which overcomes some of those social determinants of health, which are barriers not just culturally, linguistically, but also from the resources that are not in the community or they are in need to connect with. Next. Resilience factors. As human beings, it is not just in a pandemic situation or from a perspective of all chronic diseases and we're on boards with it, being strong role models, willing to change, facing adversity, self-directed, Providing and empowering people through self-direction is important if we provide them the tools that are necessary to be successful. Grateful. We as servants, all of us on the Georgia CEAL team and at the HHCGA, are grateful for the work that we do. We have a purpose in life. Our purpose is to serve our community in totality. Life has a meaning, and life has a meaning for all human beings. So it's important to always keep that as a resilience factor, because the stakeholders and the communities need to be resilient collectively and be optimistic to a positive future. Enjoy making plans, carrying them out. Do it in a team effort. We have overcome so many barriers collectively by this effort throughout the last 3 years and forward going, because we chose to be leaders, to have a purpose, to be grateful. We could make changes where were necessary, and we always kept our finger on the pulse to see what needed to be adapted and grow as we moved forward. Next. Public health pandemic responses. Over the last 3 years, all stakeholders, all humans, all constituents of the state of Georgia significantly learned a lot from having forward planning. The communities have great needs. They have great needs in the rural populations. They have great needs in the metroplexes. You need to know how to allocate the resources to the community to prevent, prepare, and respond to the pandemic. But you also need to be very cognizant as a stakeholder that other pandemics could be on the horizon. And also with COVID-19, we saw flu, we saw HPV, we saw expansion, unfortunately, of other chronic diseases such as diabetes, heart disease, scans for cancers, oral cancers, and so forth that were undiagnosed or not gone through a proper protocol because the community did not have the services at the time. So the collective approach of pandemic response and being forward thinking and treating an individual and educating an individual and uplifting an individual through mind, body, spirit, and all of the other indicators that come together. Serving in a COVID-19 scenario was just not about COVID-19. It was about everything else that went along with it. And how do you move forward to make certain that that is addressed from a state perspective, county by county, either in a metroplex or in the most rural places, and connecting the dots so that all services, all education, and all advocacy can be completed in a totalitarian manner. Next. Resilience factors. All humans have individual factors, family factors, community factors. Knowing the difference between protective factors and risk factors helps in best practices planning so that an individual has control of their life. They have the information that they need. If you do not have the information that you need or the resources, that would be the example of a protective factor versus a risk factor. Family factors. Families come in all different generations. Family come in all different configurations. So knowing the family factors and how those can impact having a protective perspective and approach so that you can overcome the risk factors, which also go back to mental health and the other chronic diseases, is critical. Community factors. Most social determinants of health entirely impact underserved populations. So knowing the protective factors to have better outcomes and to try to alleviate some of the risk factors or provide a plan for better outcomes and resources is significant in this huge undertaking that our entire CEAL team has completed and continues to do over the last 3 years. Next. So in synopsis, if we look from the experience, where we had the greatest trajectory is bringing all stakeholders together, in health fairs, Feria de Saluds, bringing chronic disease resources, onboarding nutritionists, physicians, clinicians, medical students, rapid testing, also applying the protocols for other testing and resources to chronic diseases, and engaging the entire family as a whole significantly helped overcome many barriers. We also worked very collectively with the Hubert School of Emory on health passports and rapid health assessments, along with the CEAL umbrella, so that we could quantitatively and qualify the information and the statistics that we were receiving back through our passports in the field to make certain that we were uplifting in the right areas, one, geographically, and two, to all the chronic diseases and COVID-19 response protocols that needed to be enacted, expanded, and moved forward with. Next. Georgia CEAL and the CCB activities has allowed us to create so much trajectory and traction throughout the entire state by the entire list of individuals, organizations that were demonstrated earlier in the presentation by Dr. Akintobi. And from that perspective, you can see what we have accomplished. Dr. Akintobi.
Thank you so much, Bella, for your leadership and your contributions towards making our state better, and certainly working with us in our work related to COVID-19 response. So next, I am so pleased that Dr. Sadia Khizr can talk about our unique, innovative, and so important and timely work of our vaccine trial unit that certainly was poised and ready because of our relationships of trust to make sure that there was representation of disproportionately impacted communities in vaccine trials. Dr. Khizr.
Hello, everyone. Thank you, Dr. Akintobi and Bella, for the beautiful presentation of all the efforts over 3 years. I'm Dr. Sadia Khizr, and I work at Morehouse School of Medicine with Dr. Immergluck, who is a pediatric infectious disease. We became part of NIH vaccine trial unit in August 2020, and that was just something to behold, because we basically started from scratch, and that's what we kept telling our team, that we are building the plane and we are flying it. So we were part of the CoVPN network. As I'm sure all of you know about, CoVPN is the network that brought together the quick production and then dissemination of the vaccine. Just to reiterate, none of the vaccine were done quickly, as the myths are talking. None of the important steps were bypassed. Everything was done very accordingly. It was just done during pandemic, so it was done over a whole bigger stage compared to the usual. Next, please. So the vaccine trial unit mission goes with the Morehouse mission, and it is that addressing health inequities through safe and effective vaccine development and trials, with the focus on emerging infections, HIV, and other vaccine preventable conditions. And it is important to know that, yes, we are doing this, and we are right now concentrating our efforts towards COVID, but there are many other emerging infections that will need the same network, that will need the same connectivity that Georgia CEAL has offered during this pandemic time. We also, besides vaccine trial unit, we also have the pediatric clinical and translational research unit, and that goes hand in hand because we are leading innovative clinical and translational research to improve the health and well-being of all children, with emphasis on minority and medically unserved children in Georgia. I specifically want to say that because this is a very big deal for us to be cognizant with our parent institution, Morehouse School of Medicine's mission statement and what we stand for. So what happened? To give you guys a background, like I mentioned a little bit earlier, that we were selected as a site by NIH in August, and we just came together. We looked up for the staff, we looked up for all the people, even though we have a really good clinical research center, which has been doing research for a long time, but we had not done something at this huge level within a specific timeline. And of course, we were selected because we do represent the minorities. We do represent the Black African American community along with the Hispanics, Asians who come to us and who trust us, who trust Morehouse School of Medicine, because we have always been there. So that should never be forgotten, because our community engagement team really put in a lot of effort to get us all these people and to getting all our minority population in, that range from literally from professors and faculty at Morehouse School of Medicine all the way down to just 80, 90-year-old people who just wanted to be in there because they wanted to show their family that, yeah, the vaccine is fine, the vaccine is okay. So our first trial was Novavax adult vaccine trial. We had a really, really good input here. As you can see, we had to enroll within 6 weeks time period. And we did, we enrolled 171 during that time. We were working around the clock. We had help from Georgia CEAL team. We had help from Bella's team so that we can go and get all our diverse community to reach out to them, to get them in, and then to keep them in. The trial is still going on, just so you know. We are all at the tail end of the trial, and it's supposed to be ending mid-April. We're still doing the follow-ups because these subjects not only received the initial vaccines, but then they received the booster vaccine, and then they also received the final vaccines. And in between, since it was a randomized clinical trial, meaning that some people got the actual vaccine and some got the placebo, we had to do a crossover. So after like 2 months of enrolling everyone, we had to get them all back again to give those who did not get the actual vaccine, to give them the actual vaccine, because we did not want them to be out there without a vaccine in this pandemic. So, but I think the real heroes here are all our subjects who came, who despite whatever issues, they were answering our calls. They came at different times whenever we asked. Novavax had a lot of like changes over the protocol, so we had to call them multiple times to come in just to sign the consent until we got permission for the e-consent, which we could do. And still our population, all of them cannot do e-consent, right? They do not have the means, they do not have the resources. So we were always open for them, and we were always there for them to come at whatever time suited them, whatever time worked for them, because we were very, very thankful for them to be part of the study. And we became their resource, not just for the trial. We were their resource for each and every COVID-19 related question. We were their resource for whatever CDC was coming up with. And there were so many confusing messages out there that having us as a resource was a big deal for them. And we are continuing that relationship still. But not only that, we met such great people during that time, and resiliency and their and the grief that these people were going through because of their families. It was truly heartbreaking at so many times. So if we can go back just a second, I just wanted to, I know the slide doesn't show it, but I wanted to say that we had 65% was African American, 10% was Hispanic, 10% was Caucasian, and then we had 5% Asian, and the rest were like some who did not identify their ethnic background. So just saying that we had a very, very diverse population coming in. And these are the people who are going to be our cheerleaders in the community because of how well we were able to handle them and take care of them. So hoping to get more people going forward. And Novavax vaccine, as you all know, it is now EUA approved. The booster is also there on the scene. It is now being tested in children and the pediatric population. We are part of it also, the pediatric one as well, which started last year. So it was a huge honor to be part of this and still being part of it. Next, please. So COVAIL, the short name for this one was COVAIL. And this is the study, it's really a groundbreaking study because this one, we enrolled patients for all the different vaccines, Moderna, Pfizer, Sanofi. And then once we had them, it was actually looking at different variants. So these are for the vaccines that were already approved, but now we're looking how effective they are against the Omni, against the Delta, and all the other variants that were coming in, and to learn more about COVID and their long-term effects and the long COVID story that's going on and how it is being transmitted. A lot of literature, if you look it up, want to look it up, a lot of literature that recently came out from NIH and all the meeting, it is due to this very, very important study, and we are proud to be part of this one as well. Next, please. So currently we have active 6 study ongoing in which we are basically looking at, this is also a nationwide study. The big thing about this study is it is literally going on in all 50 states. And it is enrolling the current COVID positive subjects to see if the medicine that has already been approved for other things like Montelukast is approved for asthma. We have ivermectin that is approved for other diseases. So already FDA approved studies, medications that we are trying to see if they will work for COVID-19 in the non-hospitalized patients. So that one is currently ongoing. Next one, please. And this is our latest hummingbird study, which is basically the Novavax in children. So this is for children all the way from 6 months year old to all the way to the 12 years of age. And we are currently enrolling in this one. They're doing it by cohort basis. We are looking for, again, we are employing the same community engagement. I know people think now that, oh, COVID is over. That's not true. So it's been a little harder to get more people in it, which is a good thing in some way because maybe they have already been vaccinated. Great. If the child has already been, if they have not been vaccinated, then maybe those people have already made up their mind that they're not going to get the vaccine. But still, we are able to find people who are really willing to be part of the study and to be the cheerleaders and promoters for this study. And we're trying to get into more success about it to get the similar representation. And just to reiterate again what everyone is saying, that this is not just for COVID-19. This is for all the vaccines, whether it's flu vaccine, whether it's, we are doing a GSK varicella vaccine ongoing, we have pneumococcal vaccine, we have RSV vaccines coming up, and of course the medicines for them. So research is really, really important and integral part of getting us through a pandemic. And I guess I shouldn't say it, but we all know at some point or another one is going to happen. So we just need to be really, really learn from the lessons we learned here, apply them, and be prepared. We do not need to be always reacting to when it happens, when we are all running around and trying to do it, how we are doing it, are we masking, we are not masking, how are we getting the patients in, how are we doing it outside? We had tents outside where we saw the people when it was really high COVID, institution would not allow them inside, rightfully so. So we had to think out of box, all these things, how to do it. We did drive-through kind of our study with the drive-through vaccine part, things like that. But that gives us now a framework to see how we are going to be moving forward in case it happens. And we should have a proper protocol, a proper emergency preparedness plan to be better off if and when it happens again. Thank you so much for giving me the opportunity to talk about our vaccine trial unit here.
Thank you so much, Dr. Kizzer. As you've heard, community engagement is the resounding, irreplaceable theme when we think about recovery from a pandemic, community leadership like Bella, as well as vaccine trials participation is so important to ensuring that everyone is a part of not just the problem, but the solutions. And again, the model that we collectively stood up is one that can be adapted to other public health issues and towards prevention in all different ways. So collectively, through partners like Bella and many others across the state, we were able to vaccinate, to administer over 75,000 vaccinations. And so while that didn't address all the issues in Georgia, it contributed to the whole, such that both Black and Latinx communities collectively ended up being vaccinated at a rate similar to their white counterparts. And we're very proud to have contributed to that. And so we had a marketing campaign that was based on what we heard and learned, so people could share what their why is or was in terms of thinking about COVID-19 vaccination. There was geofencing and geomapping, such that messages would come on folks' iPhones, and then shirts as well as posters, and as you can see, billboards there. And then social media monitoring, and that's something that certainly if you're interested, we can share that information with you when we have our Q&A session. But we know that social media can be, using Bella's term, they can be risk or protective factors in terms of being the best ways to share misinformation, disinformation, or the right information. So people are armed with what they need to be able to make the best decision. So we worked with and continue to work with community leaders to help us to determine what those messaging platforms and dashboards should look like. And that work is still in progress. So very quickly, I hope I'll share a little bit of what we garnered in terms of community wisdom that was based on the Community Coalition Board and networks across the state of Georgia and other partners that really helped us to understand what primarily Black and Latinx communities in Georgia were thinking about, understanding, and doing when it came to COVID-19 vaccine trial participation, as well as testing. And so we know that this evolved and continues to evolve over time, but in the brief final slides that I'll talk about, hopefully it will give you some ideas related to tools you can use in engaging communities most effectively, both now and in the future. So very quickly, we administered 2 surveys that were based on the national CEAL network, where all CEAL sites nationwide were invited to help to ensure that there was a survey that included key questions that we all use. But through our Community Coalition Board, we worked to make sure that all of those questions were also Georgia specific and sensitive. And so here you can see the folks who were eligible. They had to be 18 years and older, Black or Latinx, which was important to us. And so this was not a survey that was generalizable to all Georgia residents, because not all Georgia residents represented those that were disproportionately impacted. So we were very thoughtful about making sure that we chose counties and residents where there was higher COVID positivity rates, less testing and vaccination. And also we use the CDC validated social vulnerability index that is used to identify counties where there are higher risk factors when we think about both social, political, and other determinants of health that place us at certain communities at greater risk, and also opportunity for intervention. The first survey happened when we were all norming to a new vaccines between April and June. And then the second survey took place November 2021 to January 2022. And they were administered electronically, but also face-to-face electronically during the first administration. And then in the second, when we were beginning to go back into communities, the survey was administered at face-to-face events, in addition to using electronic administration through tablets, as well as computers and phones. This is really small, but overall, it lets you know that we met our targets of engaging over 4,500 Georgians that met those eligibility criteria. And that could have only been done through partners like Bella and many others who were a part of the CCB to get the word out, to encourage people that their voices mattered. And certainly we provided an incentive that was designed to acknowledge their time to lend their voices. And so you can see some of the other details here, which in the Q&A will certainly detail for those of you who are interested. Most importantly, I wanted to share some of the predictors, meaning those characteristics that really helped us in terms of the statistics to identify those that were likely to get tested for COVID-19. And so what we found is when we compared those who completed the survey in late 2021 to early 2022, we found that Fewer were likely to get tested, and we think that might be because more people were getting vaccinated, and that's still a challenge, right? Because vaccinations don't eliminate the risk for COVID-19, but they mean that you will likely not be hospitalized, that your experience of COVID will be milder, and you will certainly not die. And so when we look at comparing where we were in 2022 to 2021, we see that more people during the second administration were less likely to get tested. That means we have work to do because testing is still important in mitigating risks. And as Dr. Kizzer said, COVID-19 has not gone away. We found that males were 1.4 times more likely to get tested, and that Blacks compared to whites were 44% less likely to get tested. And then finally, you can see some other factors there. People who were employed were more likely to get tested, and we think that's likely because employers are requiring testing. Those with a college degree or higher were more likely to get tested, and those who trusted federal health authorities were more likely to get tested. This, to me, is particularly important because we know that trust is important. And so for minority communities and others that have been disproportionately impacted by any health issue, their trust in federal health authorities is much lower. And so if we care about that important trust factor, it means that we must do the important work of those that represent health organizations to establish that trust so that there is trust not only in them, but also in things like getting tested. And what we also found was that unlike testing, people who completed the survey closer to 2022 were 2.6 times more likely to get vaccinated. And we think because by the beginning of 2022, more folks understood that they were eligible for, or maybe were required to get vaccinated for work, among other factors. And so that's not as surprising. But what we saw also was that Blacks were 50% less likely than whites to get vaccinated. Those who were 18 to 30 were 45% less likely to get vaccinated. And so that's another potential opportunity. Those who are younger across many health issues are less likely to go to the doctor, get screened for preventive services. Some of it is because they may not have insurance. Some of it also it might be about their perception of risk. And for this, we hope it will give you some indication of groups that we need to be focusing on anyway when we think of prevention messages. Also, those who were employed, who trusted federal health authorities, and also responded positively and correctly to COVID-19 knowledge questions related to the transmission of COVID, how COVID attacks the immune system, and that wearing masks is not harmful, meaning they did not agree that masks were harmful. Those were people who were more likely to get vaccinated. So this also indicates that knowledge is important. And then trust again came out as an important factor. So as we think about our work, this is not just about COVID-19 vaccinations and testing, but is also about that pursuit of trust and who are the best messengers what are the best messages to promote. Participants who didn't plan to get the COVID-19 vaccine, they cited concerns about the side effects, as well as trusting the safety of the vaccine. And to Dr. Kizzer's point, this is an important education component, and trusting resources like Morehouse School of Medicine and others to really dispel some of the concerns, justified concerns about side effects, as well as trusting the safety of the vaccine. So this shows you some of the areas potentially of intervention in terms of education, so that people who are not considering getting the vaccination can have messages that represent their particular concerns. And then those who decided to get the vaccine, they were motivated because they thought that keeping their family, community, and themselves safe were important. So that might be something that's also promoted among those that we know have turned the corner towards making decisions to be vaccinated. So we thank you for your time today and look forward to engaging you in an interactive discussion based on what you've heard and the ways that you're leading to make communities healthier. Thank you.